Hi, how are you? My name is Zoya Karshigieva. I'm going to be doing the the eye exam. Okay, so hi, how are you? My name is Zoya Karshigieva. I'm a PA student. I'm going to be
Never met you
performing the eye exam. Okay, so I'm going to start with inspection and palpation of the nasolacrimal ducts. I'm going to start with inspecting. I'm looking for any swelling. I'm looking to see if there's any discharge, drainage, if there's any infection, pain. Okay, now I'm going to be palpating the nasolacrimal ducts, and I'm just looking to see if there is any swelling, if there is any inflammation, any infection, if there is any discharge from the eyelids. And upon inspection and palpation of the nasolacrimal ducts, they are intact without any infection, inflammation, or swelling. There is no inflammation of the eyelids. There's no there is no nasolacrimal duct infection, and there is no discharge, purulent discharge from the eyelids. Now I'm going to start with inspection of the eyebrows, the eyelids, the eyelashes, the sclera, the conjunctiva, and the cornea. I'm looking at the eyebrows and I'm looking for hair distribution, looking to see if there's any scaling, if there's any redness, if there's any flaking. And upon inspection of the eyebrows, they are normal hair distribution bilaterally. There is no redness, there's no scaling, there is no dry skin. Now I'm looking at the eyelids. Can you close your eyes for me for a second? Thank you. And I'm looking to see if there is any swelling, any hordoleum, styes, any redness, any dry skin, and the eyelids bilaterally are appearing normal without any swelling, redness, no hordoleum, no styes. Now I'm going to be inspecting the eyelashes, and I'm looking to see if there is any entropion, ectropion, looking at the hair distribution to see that they're normal bilaterally, to see if there is any flaking or crusting. And there's no swelling, there's no flaking, no crusting, there is no entropion, ectropion, and the hair distribution is equal bilaterally. Now I'm going to be checking the patient's sclera and the conjunctiva. I'm going to be inspecting the sclera and the conjunctiva, and what I'm looking for is to see if there's any injection, icterus, or exudates. And upon inspection, the sclera is white, the conjunctiva is clear, without any icterus, injection, or exudates. Now I'm going to be checking the patient's visual acuity before shining light in their eyes. I'm going to be giving them the pocket chart test, and I'm going to ask you to hold it 14 to 16 inches away from you and read the smallest line that you can see.
A
Mm-hmm.
F L O N.
Good. So patient's visual acuity is intact bilaterally of OD, OS, and OU without any corrective lenses. Now I'm going to be performing the visual fields by confrontation test. I'm just going to ask you to get up for a second. Face me. Okay, a second. All right, good. Okay, cover the same eye. Good. And don't move your hand, okay? And don't look at my hand, look at me. Tell me when you see my hands wiggling.
See it. See it. See it. I see it.
Okay, good. You could have a seat. Okay, so patient's visual fields are intact bilaterally, patient's visual fields are full by confrontation. Now I'm going to be checking the patient's visual accommodation. Okay, so I just want you to look at my finger. Actually, look at the wall over there. Okay, and then now look at my finger. Good. So I'm looking for pupillary constriction, and now I'm going to be shining light in your eyes. And what I'm looking for is pupillary equality. I'm looking to see the pupillary reactivity to light bilaterally to direct and consensual reflexes. Okay, so let me just grab my pen light. Okay, I'm going to be using my flashlight. Okay, look at me. So I'm going to be shining the light in the right eye. And what I'm looking for is direct reflex direct reflex to see if there is going to be any constriction of the pupil, and that's going to be direct reflex. And then now I'm going to shine the same light in the right eye, but I'm looking at the left eye for consensual reflex. Now I'm going to do the same thing here, direct and consensual. Very good. So pupils are equal, round, reactive to light, and accommodation. Now I'm going to be checking the patient's extraocular movement in all 6 cardinal positions, looking for lid lag and nystagmus. Okay, so look at me and follow my finger, okay? Very good. So patient's extraocular movements are intact in all 6 cardinal positions without any lid lag or nystagmus. Now I'm going to be performing the fundoscopic exam using my otoscope. I'm going to be looking for red light reflex. I'm looking at the arteries, looking at the veins, and looking at the optic disc. Okay, so I'm going to start with this. All right, so I'm going to start with this eye. Okay, good. And now here. All right, good. So upon the fundoscopic exam, there is red reflex present bilaterally. The optic disc margins are sharp without any hemorrhages. There is no arterial narrowing or AV nicking. Thank you.